Hello, my name is Craig and I am the Sim and Immersive Tech at CDDFT. Today I am going to be taking you through the HoloLens 2, which is the second iteration of Microsoft's revolutionary head-mounted mixed reality device. It's a device you can wear on your head with a visor over your eyes, which enables a completely new way of interacting with information. It's a self-contained device with everything you would expect from a laptop or a computer. Over the next 5 minutes we'll be looking at some of the applications the HoloLens 2 has to offer. The first one that we're going to be talking about is JoinXR. JoinXR is a remote meeting platform that is designed for collaboration with colleagues and clients from around the world in a holographic meeting. Lifelike avatars from a single selfie make you feel like you're in the same room. The application lets you create rich presentations and share them in real time, much in the same way a PowerPoint would be created, presented in a very similar way that a Teams meeting would be. Here we see a group of students who are able to interact with a 3D image. They are able to pick up the brain, they are able to move it around, they're even able to pass it to their colleagues. The application is very intuitive. With a few simple hand movements, I'm able to grab and resize the 3D models, and with a few simple clicks, I can even look inside the model. The next application we want to talk about is HoloPatient. HoloPatient is an immersive 3D learning application that helps students assess, diagnose and treat real-world conditions through true-to-life holographic simulations of standardized patient scenarios. The HoloPatient application helps accelerate learning benchmarks by allowing learners to practice visual observations and assessment skills in an environment where the instructor is completely in control of the way the scenario unfolds. In real time, the educator will observe the same patient, consult with the learner, review supplemental information such as test results or charts, and discuss assessment and diagnosis. This methodology allows the learner to focus on visual cues and data to gain insight into the patient conditions and infer diagnosis and care based on evidence. The app gives students the opportunity to explore the same simulated patient scenarios in a closely controlled setting, removing the pressure and risks associated with real patients and actors. It lets students develop and hone skills for enhanced clinical preparedness by using visual cues and data to assess patient conditions, infer a diagnosis, and collaborate on the best approach of treatment and care. The next application we'd like to talk about is HoloHuman. HoloHuman is the world's first 3D anatomy model created for the immersive exploration. The solution provides a learner with the ability to interpret the depth and relative position of anatomical features through a virtual and visual spatial model. As HoloHuman is a cost-effective and repeatable resource, education institutions and facilities can extend limited resources, such as cadavers, and encourage independent and detailed exploration of 3D anatomy. Offering unprecedented insight into human anatomy, HoloHuman features and systems that are typically difficult or impossible to see in a cadaver are shown accurately in a holographic 3D. The solution gives perspective on the human body systems, including over 4,500 named and described anatomical structures to explore.